we are honored, and really we do appreciate the recognition that Friendship Bench is given both locally and internationally. But having said that, I also would like to emphasize that the Friendship Bench model is not a perfect model. I like to look at it as work in progress, where we are constantly iterating with the aim of coming up with something that is more robust, something that works more efficiently. So it's constantly work in progress. And what I really love most about Friendship Bench is the interaction with the grandmothers, like grandmother Morania here, who is one of the longest serving grandmothers on the Friendship Bench. And we have close to 700 grandmothers at the moment who are delivering Friendship Bench therapy on these wooden park benches in over 100 communities across the country. And the other, interesting thing about this work is it really focuses on common mental disorders. So the idea is to use grandmothers to narrow the treatment gap for common mental disorders. And let's just have a little bit of background into common mental disorders, particularly depression. So depression is a leading cause of disability globally. Most of you are aware of that. And over 300 million people are affected globally. And sadly, every 40 seconds, someone dies from suicide in the world today. In addition to that, we know that loneliness, according to what the World Health Organization tells us, loneliness is now a global epidemic. Now, with all these challenges, one immediate question that we ask is, how can we possibly treat all these people who are affected by common mental disorders? And the treatment gap, we talk about the treatment gap in global mental health. And when you think of the treatment gap of just psychiatrists or clinical psychologists, it's quite alarming. In low and middle income countries, you have an average of one psychiatrist for 1.5 million people, which literally means that 90% of those in need of what we call evidence-based therapy will not get it. And that is essentially where therapy on a park bench comes in, because this is our solution towards narrowing that treatment gap, working with grandmothers who are rooted in their communities and trained in the basics of cognitive behavioral therapy. They then get referrals from the local clinics and the community and provide this therapy on these wooden park benches. So in a very simple way, these grandmothers are creating space for healing on wooden park benches. If you think of the current situation that we're facing today with the COVID pandemic, there's a great sense of loss that the global community is facing. A sense of loss in terms of structure, in terms of identity, in terms of the future, where we're going. There's a sense of loss in terms of attachment. And often I see the work that the grandmothers do on the bench, not only as work that seeks to address common mental disorders, but to also address some of the more basic human needs, like connecting people together, bringing a sense of belonging, creating a sense of purpose in our communities. And so the wooden park bench, in a lot of ways, symbolizes not only a platform to treat depression and anxiety, but really a platform to create human connections. And so it's a lot more than what meets the eye. One of the first big publications from Friendship Bench, which actually showed that this work does make a difference, was a cluster randomized controlled trial, which is published in the Journal of the American Medical Association. We have subsequently carried out 2 other clinical trials, one of them a cluster randomized controlled trial in people living with HIV, the other one in young adolescents. And those have actually shown as well that Friendship Bench is very effective. And so the Friendship Bench clinical trial, what it showed was that after 6 months of receiving therapy from a trained grandmother on a wooden park bench, participants were still symptom-free. And these grandmothers proved to be a lot better at alleviating symptoms of depression and anxiety than enhanced usual care, which was your trained mental health nurses, psychologists, and psychiatrists. And so we were really excited about that. But just to illustrate the findings from that clinical trial, the blue columns in both these diagrams represent baseline scores at enrollment, or rather on enrollment. And the orange columns show the change after 6 months. And as you can see, this is the control or enhanced usual care. And in the intervention, there was really a significant change. That difference was statistically significant. And that was using the locally validated SSQ or Shona symptom questionnaire. We also used a more internationally recognized screening tool, the PHQ-9, and that too showed this this massive difference, you know. And when you think of all the numbers of people that have been reached so far in Zimbabwe and beyond, we don't really have accurate figures, but it's close to 100,000, you know. And to date in Zimbabwe alone, we're looking at about 700 grandmothers and probably 30 supervisors. So I think when you think of the model itself, it's really contributing towards narrowing that treatment gap. But as I mentioned earlier on, it's still work in progress, because ultimately the vision of our team is to have a friendship bench within walking distance everywhere. So we've still got a long way to go. And in order for us to actually achieve that, we need to be constantly iterating and thinking of ways of how best to improve Friendship Bench. So in a nutshell, this is what we do at Friendship Bench. We train trainers in the community who then go on to train grandmothers, and those grandmothers are allocated a park bench. And after clients are referred to the park bench and receive between 4 to 6 sessions, they are then referred to a support group, and that cycle kind of continues, you know. And so it's fairly simple, but each and every one of these components has several nuts and bolts that constantly have to be tweaked, and things do go wrong from time to time. In all of this, for instance, one of the biggest challenges is fidelity. How do you ensure fidelity, that every single grandmother is doing exactly what they're supposed to be doing? That's a challenge which we're still battling with in Friendship Bench, because very often we get different things produced, you know. And in terms of the group work, here is an example of a group session in progress. These groups have become quite powerful in some areas where they are running, and they've been running for years. And we have actually realized that there's a need to focus on strengthening the groups and making the groups a lot more conspicuous as opposed to just the work on the bench, because friendship bench is mainly recognized for what happens on the park bench with the grandmother and not what happens in the support groups. And we are starting to actually work actively towards making the support groups a lot more conspicuous as well. And we have introduced this model in different parts of the world. We've piloted in Zanzibar and in New York City. We are not so involved in Friendship Bench New York City anymore. So we really are not very clear in terms of what is currently happening in New York City, but we are in touch with Zanzibar, and there are plans to actually work with Zanzibar this year in an effort to further strengthen Dawati Rafiki, or the term that is used in Swahili for friendship bench, so that, you know, we intend to strengthen Dawati Rafiki in Zanzibar. And so ultimately, you know, over the years, one of the things that I have learned from Friendship Bench is that it's in essence about creating space for people to tell their stories. Because when you really think about it, human beings resonate through storytelling. Yes, Friendship Bench is embedded in a lot of research with well over 50 peer-reviewed publications, but at the core of it all is human interaction. Just the other day, I was talking to one of the grandmothers, and I asked her, you know, why some of the clients coming to the bench, from the data that we have, we're spending a few minutes on the bench as opposed to at least a minimum of 30 minutes, which is what we think, you know, is ideal to see any meaningful change. And her response was, "Doctor, how many hours or minutes do you think it takes for two human beings to connect?" And her argument was, a lot of the young people coming to the friendship bench don't actually have anyone to talk to. They don't have anyone to connect with. And most of the times they are interacting with their devices. And so when a young people comes to the bench, and when a young person comes to the bench and spends 10 minutes talking to me face to face, the value and the power of that is profound. So I found that to be quite an eye-opener, and you know, an alternative way of looking at some alternative angle of what Friendship Bench is offering, you know, the ability to connect people. And after all, in this time and difficult period that we're going through, connecting as human beings becomes really essential, which is indeed the value of Friendship Bench, you know, empathy and connectedness, which are rooted in you know, in research. And this is an example of Friendship Bench in Kericho in Kenya. And in Kenya, they have friendship benchers in the tea plantations. Again, it's really all about ultimately, it's about human connection. It's ultimately about people interacting, you know, face to face, without devices. You know, when devices are used, devices are generally used for recording a session or for entering some kind of data. But that's one of the things that I found, as I mentioned earlier on, you know, to be quite revealing. You know, when you look around you, often people are a lot more engaged with their devices. And according to the grandmothers, you know, the Friendship Bench is one place where you come and you engage with a human being, even if it's for a few minutes, as opposed to engaging with your device. it's quite interesting when you think of it that way. Another aspect of Friendship Bench, which I would like to highlight, is our response to the challenges faced linked to the COVID pandemic. So we are currently in the process of providing, Friendship Bench via the phone or through a digital platform. And this was all in response to COVID when it first hit in March last year. And so we've made it possible for those who cannot access a bench due to lockdown and need to talk and need to interact with someone, they can do so through our online digital platform. This, unfortunately, is not very clear, but this was meant to really highlight a new collaboration with the Ministry of Health, an NGO called OFID, and through the support of USAID and PEPFAR. We're really excited about this new initiative, which starts this year, where we are focusing on people living with HIV in the community and in all the health facilities in Zimbabwe. And through this new collaboration and our strategic plan for the next 5 years, we are hoping that we should be able to reach 1 million patients by the year 2023. It's very ambitious, but I think, with our vision of having a Friendship Bench within walking distance everywhere, we have to have very bold ideas about where we want to go and where we want to take this model in the next couple of years. And so ultimately, in every community on the globe, we would like to create these spaces for community healing through the introduction of wooden park benches, which are primarily driven by grandmothers. And people often ask me, why grandmothers? In Zimbabwe, obviously, we used grandmother initially because that's what we had at the time. We didn't have any young professionals when Friendship Bench first started. But when you think about the population of elderly people today, and the rate at which the elderly population is growing, or rather people who are aged 65 and above. I know in the Western world, often people, as they get older, they are retired and they get on a pension and stay at home or go into an old people's home or something like that. I really think we need to leverage the wisdom and skills that the older generation have, not only here in Africa, but across the world. There's a real need for us to focus on intergenerational connectedness by working closer with elderly people and making the world a better place for everyone. And I'd just like to conclude by sharing this last photograph of one of the pioneers of Friendship Bench, grandmother Rudo, who passed away, I think 2 years ago now. And, I had the opportunity to spend some time with her before she died. And one of the things that she said when I visited her was that the Friendship Bench had given her a sense of purpose in her community. So ultimately, Friendship Bench is about creating a sense of belonging. And I see Friendship Bench as a vehicle for creating that through the introduction of mental health care in communities. But really, ultimately, it's about creating belonging and creating a sense of purpose, something that I believe is greatly needed in the world today. Thank you. So I'll stop there.
Thank you very much. That was a really interesting talk, and I know that I definitely learned a lot. So thank you very much. I think we have a couple of minutes now for a Q&A. If anybody has
can I stop sharing? Is that okay? How do you want to do this?
Yeah, feel free to stop sharing your screen. Cool. Yeah, so we've got a few minutes now to do a Q&A. If anyone has any questions, please feel free to post them in the chat, or if you prefer, you can message me directly and I can relay them in the chat for you as well. Give it a few minutes for people to type out their answers or questions. I actually had one. I think Anna said, yeah, there we go. They're all coming through now. I'll let you answer them, Dr. Chibanda.
There's one here. How did you get involved in Friendship Bench? Did you face any hostilities from the community, the grandmothers? There are several questions, but I'll start with this one. So I essentially created Friendship Bench in 2000. In 2005, here's a very brief summary of the story behind Friendship Bench. In 2005, I was studying for my master's in public health, and we had the government of Zimbabwe embarked on a cleanup operation, which resulted in over 700,000 people being left homeless and over 2 million people affected psychologically. And at the time, as a student doing my master's in public health, I was instructed to actually go into the community and figure out what could be done. And that's how Friendship Bench actually started. So the initial first step was a survey. And after the survey, I had to come up with some intervention on how to address the huge burden of psychological morbidity in the communities. And so I started off with 14 grandmothers because that was all that was available at the time in terms of helping me to do this work. And so from 14 grandmothers, we have steadily increased our numbers, across different parts of the country. So that's how Friendship Bench started in a nutshell. How can we participate in the Friendship Bench? There are so many questions here, and I'm not sure how to tackle them. Do I go from the top, maybe?
Yeah, if you want to.
Because those came in first.
Yeah, if you just want to work in order, that would be perfect.
So this is Ilana. Hi, Dixon. So nice to see that you're looking healthy. Yes, I'm looking healthy. For those of you who don't know, I contracted COVID 5 weeks ago, but I have recovered. I'm in a better space now. Thank you very much. I hope you're doing much better. Yes, I am indeed doing much better. Otherwise, I wouldn't be here talking to you all. The next question is from Lisa. What do you think of the free dial-up application that connects people for a phone call all over the world? I live alone and have had many meaningful connections that way. I think that's a great thing. If we could have something like that here, we have been trying to get a toll-free number here in Zimbabwe where people can just phone from wherever, but we're still struggling to get that. It's a brilliant idea. We're working on it still. At the moment, we predominantly use WhatsApp in Zimbabwe for most of our digital platforms. We do have an online call service as well, but people have to pay for that. So most folks don't have the money. Memory says she's sorry for my loss. I'm not sure which loss that is. I guess it's the grandmother. Yeah, well, yeah, thank you very much for that. Are grandfathers involved at all? In Gweru, that's one of the cities in Zimbabwe, there are, I think, a few grandfathers who are involved. But initially when Friendship Bench started, we did have quite a substantial number of grandfathers, but grandfathers were not as committed as the grandmothers. And one of the challenges in the early days that we had, grandfathers tended to prescribe, to give advice, to tell people what to do. while Friendship Bench is really more about creating space so that people tell their own stories without you dictating what they should be doing. So yeah, we do have a few grandfathers, but the vast majority of our delivering agents are grandmothers. How did you get involved? This is Ga Kitada. How did you get involved in Friendship Bench? Did you face any hostilities? I think I've already talked about how I got involved. I started Friendship Bench, and yes, there were hostilities from professionals, from peers as well, who thought I was crazy and up to something that was not going to work. But, you know, as they say, the rest is history. And this is from Theodora. In training, how do you dismantle cultural stereotypes around mental health? Great question. Friendship Bench uses indigenous concepts and indigenous words to navigate through the sessions. We don't talk, for instance, about depression, but we talk about kufungisisa, which literally means thinking too much. The sessions of Friendship Bench consist of kuvurapfungwa, which is a Shona word, which means opening up the mind. And the next step is kusimudzira, which means to uplift. And the third one is kusimbisa, to strengthen. And so by using all these locally in defined terms, not only do the grandmothers feel comfortable to do this work, but it also becomes attractive for the local community. So we don't use any of your DSM-4 or DSM-5 or ICD-10 classifications. The key thing with Friendship Bench is we are not out to label people. We are out to listen to your story, you know, because everybody has a story, regardless of whether they are suffering from depression, bipolar disorder, or schizophrenia. They have a story, and that's what we focus on, the story. And I think this is part of the success of this model, making people feel that they are human, using empathy. You know, empathy is the ability to make people feel understood and respected. And that's what we strive for. And I'm not saying we always manage to do that, but that's what we ultimately want to do. And as I say, because it's not a perfect model, we are striving to have all of that. Thank you. Should I stop? Do you still have time? Or what would you like me to do? Because there are lots of questions here.
Yeah, there's quite a few questions. If you have time, it would be great if you're able to answer them, but obviously we completely understand if you need to drop off.
I still have a bit of time. I still have a bit of time, so I'll carry on. So thank you. One of the most inspiring talks I've seen recently with the shift to digital platform engagement. To what extent does that help or hinder the patient and grandmother experience? Edric, great question. This is work in progress at the moment. Now, there are some grandmothers who are adamant that they are only comfortable providing Friendship Bench on a bench. And then there are others who have taken on to the whole digital platform and are really happy with that. We are still experimenting with different versions of how to deliver and how to mix the digital platform with the physical bench work. But the vast majority of the grandmothers that I interact with constantly tell me that nothing can replace face-to-face interaction between two human beings. Who knows, maybe with time, it will be possible to replace that. So how effective were the benches in New York City? So New York City, I distinctly remember that the first year of introducing the benches, they received up 60,000 participants who visited the benches in New York City. But I must also add that the New York City version of Friendship Bench is slightly different from our version here in Zimbabwe, where we completely empower the grandmothers to deliver the therapy. In New York City, it's more about identifying, giving advice, and referring. See, they can afford to refer because they have the facilities to refer to. We don't, so we try to do as much as we can on the bench. And this is Thank you for the great presentation. I'm wondering why the grandmothers performed better in the study compared to trained mental health professionals. Does this mean that the trained professionals need better education? Angeli, thank you. That's a nice question. So I don't think they necessarily need better education. But if you have a trained psychologist or a psychiatrist who has to see quite a number of people within a short space of time and does not have that luxury of sitting on a bench and chilling and listening to what you have to say and connecting with you without worrying about the next person that they have to take care of, I think you tend to see a lot more empathy with the latter, you know, where you have the grandmothers who are interacting with you without worrying about the time aspect, you know. And also, I think, you know, this the reason why the grandmothers were better as well is because it highlights the importance of human connection. It highlights the power of talk therapy as opposed to just focusing on using medication. I am a psychiatrist, so I know the value of medication in therapy. There are times when we have to give medication, but there are also a lot of times when we opt for medication because it seems to be a quick way out, as opposed to sitting down and actually talking to people and working through the challenges that they may be facing. So I think it's partly that, and it's also partly because the grandmothers give you that opportunity to tell your story. And as I said, you know, obviously it's still not a perfect model because we do get things that don't go right sometimes. What does Dr. Chibanda think of dial-up? Dial-up, please. I think dial-up is an option, definitely, that can be used, particularly in this environment of lockdown where people cannot meet physically. So I think it's a good option. It's an alternative that needs to be leveraged. But as the grandmothers say, you know, nothing beats face-to-face contact with a real human being. And this is Selena. Thank you. A quick, very practical question. How do the meetings occur? Is there a scheduling process? Are there grandmothers available for other people who do not come referred by the services that just happen to know about the bench? So when we first started Friendship Bench, right, everything was scheduled through the primary healthcare facility where the clinic nurse would refer, or, you know, the local police station or someone from the community would refer to the bench. It was very structured. But as Friendship Bench began to expand, you suddenly have people who just walk in, they go straight to the bench because they've heard about Friendship Bench and they want to talk to the grandmother. And sometimes you also have the grandmother interacting with people in the community and providing therapy at community level, not necessarily at the bench, but in the house of people, in the homes of people. And so with time, it's kind of in a very natural way merged to become a program which is delivered primarily from the bench, but also outside of the bench. Caroline, loneliness is pervasive in elderly populations. Have you noticed that the grandmothers have benefited from participating in Friendship Bench? Yes, we have noticed. A colleague, clinical psychologist, Dr. Ruth, who has been part of Friendship Bench for a long time, her PhD actually focused on looking at the benefits of grandmothers being part of Friendship Bench. And part of her study showed that grandmothers who were involved in Friendship Bench had actually, when you compare with the community, had much lower rates of common mental disorders, including PTSD. And this is why I also highlighted at the end the picture of grandmother Rudo, who, you know, before she died, what she said was that the Friendship Bench had given her a sense of purpose. And I think when you have a sense of purpose in your community, you thrive. And generally, when you thrive, you become resilient, and you are less likely to fall ill from emotional, psychological conditions or challenges. What are the main causes of depression in Zimbabwe? The main causes, like anywhere else in the world, are psychosocial challenges. You know, here in Zimbabwe, we have a lot of challenges right now around COVID. There's a lot of angst around COVID. We have huge unemployment rates. You have linked to COVID, you have intimate partner violence, which is linked to the lockdown, where people are, you know, restricted in a small space. And I think this has also been a challenge in places like the UK, the last time I was looking at the data. And so when it comes to, you know, when it comes to depression or mental health, unfortunately, all countries of the world are developing countries, because the magnitude of people who are affected by mental health issues, be it depression or substance use, are staggering across the globe. And this is one of the reasons why, when you think of the global mental health agenda of really trying to use task shifting to narrow that treatment gap, because we will never have enough psychiatrists and clinical psychologists in the world. It's just not possible. Our best bet is to use people in communities who are trained, who then reach out to other members of their communities to make a difference. And this is really what Friendship Bench model is all about.
Just to say, don't feel like you have to answer every single question, because I know we've had quite a lot come through. So,
you know, there are. I'll take 3 more questions. Then I'm afraid I'm going to have to stop, because I have to prepare for my next call. Yeah.
Thank you so much for your time. I know you're very busy. I think we've had a couple of questions just about whether people are able to get involved. I've had a couple of questions through saying that they're in Zimbabwe and they're very interested in helping out. I don't know if you have any.
So yeah, sure. So what I would say is, you know, if you go to our website, we have a special kind of form that you can fill in, and based on how you want to get involved, we can assess, the team will assess and get back to you. You know, you could either become a mission partner to Friendship Bench or an affiliate partner. So we definitely do encourage people to get involved. We would like, as I said, you know, our vision is to have a Friendship Bench within walking distance everywhere, you know, and that Friendship Bench within walking distance everywhere can start off as a mission partner, to play when mental health. You don't have to be a professional. We can make in our communities by simply practicing to express empathy. Right. Yeah, of course. Can women who aren't biologically grandmothers also take part? Yes, definitely. You know, we use the word grandmother because, you know, the whole essence of Friendship Bench when it first started, you know, these were like real grandmothers. And of course, the majority of them are indeed grandmothers, you know, but we don't exclude grandmothers or elderly women who are not grandmothers. Anyone can deliver Friendship Bench. In New York City, for instance, it was predominantly delivered by a couple of folks from the LGBTQ community, you know, and it really varies. We don't impose. Last question, and then I have to go, I'm afraid. The digital platform, oh, this is from Makaita. The digital platform is pretty cool. I have used it and it helped me a lot. Thank you for this platform, Dr. Chibanda. Oh, that's a very good one to end on, don't you think? You know, and I wish this is the kind of thing I'd like to show our funders, you know.
Yeah, and we've had a lot of messages also coming through privately to me saying thank you very much for your talk. So I think everyone here is very grateful for giving up your time to tell us a bit about Friendship Bench today and to kind of answer our questions. I know there were a lot. I'm very sorry to everyone who didn't get a chance to ask your questions, but thank you very much for your time, Dr. Chibanda.
Thank you. It's a pleasure. Take care and all the best. And thank you, everybody, for listening.
Thank you, everyone. All right.
Bye.
Bye.